Hello and welcome to this short Krieg rehab coaching protocol of how to take care of your tendinopathy. I build this so it's easier for you to understand my concept of how to do the rehab by yourself, but it's also show by evidence if you know how to or how the anatomy works, how the rehab works, that it actually has better outcome compared to people that doesn't know how the rehab or anatomy works. So we're going to go through some different stages, which go through the anatomy, why this happens, different risk factors, load is bigger than capacity, how to diagnose, effective treatment, other options, and my guidelines. So, hope you're ready for a good treat. We're going to start with talking about that it's not an inflammation. Usually, we talk about tendinitis, which is an inflamed area or tendon, but in this case, it's not inflammation, which is why we don't need to rest it. It's a good thing because then we can start loading it from the start. But this structure is different because in this case, it's not inflamed, it's actually damaged. So imagine you have a donut, and inside the donut, it's the tendon is damaged. You're not able to build it. So what we do, we'll focus on the donut and build the donut stronger. As a scientist, Sean Dawkins says, treat the donut, not the hole. And that's what we're going to do. So, to understand the anatomy, this is a quick go through of your tendon. The tendon is attached to four big muscles. These four big muscles are your quadriceps: rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. They go down to, I can show you with the mouse here, go down and connect to one tendon. On above patella, it's called quadriceps tendon, and below patella, it's called patellar tendon. It goes all the way down and attached to something called tibial tuberosity, which is on your tibia. And as you see, it's a nice and thick tendon, and when you again injure it, the injury will sustain, but we will build it stronger. Which in some case, it's why it's feels more swollen and bigger because that's actually what you want it to be, stronger than before. So to go to the risk factors, what is the main cause of the tendinopathy? And that is too much too soon. So it's an easy way to put it is this chart where you see the load has been bigger than the capacity of the tendon. And that is from three different ways. It's too much intensity, the frequency of doing something is too much, or the volume of like doing 10 sets of squats is too much for your capacity. Quick go through of too much too soon. I think you're all familiar with it. One of the most common reasons for pain or injury. You've done too much for your structure. Other risk factors that you should uh, look after during the testing, because these are individual. Some are really clear that this is something you lack and this is something we'll focus on. So have a quick check off list if this is something you're familiar with when you go through the testing. One of them is decreased hip extensor strength, which means the extension of the hip, which the glutes does and the hamstring are part of. If that is a weak link with you after the testing, that is something you have to focus more on. Another reason could be decreased hamstring and quadriceps flexibility, which means it's tight around your hamstring and your quadriceps, and that make tension around the tendon, and again are one of the reasons for tendinopathy. Then you have the tracking of the patellar tendon. So if the patellar bone part is not moving smoothly, if it's jumping in and out of its track, that's one reason. And bear me with me the next one, increased knee flexion, which means when you bend, if you have a lot of knee flexion, or if you have less hip flexion when jumping and landing. We'll show this in the testing as well, but imagine jumping with a lot of flexion in your knees and little flexion in your hip. And same when landing, you take all the load in your knee and nothing in your hip. So landing and jumping mechanics are another risk factors for tendinopathy. Then you have sports specialization, which is probably your thing. You're doing one thing many times, like CrossFit. So if that's the only thing you do, like squat, 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 that's also a reason for tendinopathy instead of doing different or variety of sports. The last one is pretty fun. It's greater for people with greater jump performance, which means if you're able to jump high, that will also means that you take a lot of load on the tendon on the jumping part and landing part. So this is actually a great compliment for you. You're a great jumper, but your tendon has now taken too much load. But that's the reason, or one of the risk factors for your tendinopathy. Moving on, this is how to diagnose. I'm sorry I'm not able to move my camera, but I will go through them quickly so you understand them in the testing phase. In the testing phase, we will see how much you can load it before it starts aggravating or causing pain. And you will check out from a scale from 1 to 10 how painful it is during the different stages. If it's too painful at one point, I don't want you to continue the test because then we already know that it will just be more painful during the next test. Some of the tests are also when we add speed, and in some cases, these are more painful for some people. But again, this is just a measurement of how painful it is today and what we're aiming for the couple of coming weeks. Then there's a physical test of actually palpating for the pain. So from the movie, you will see which areas we will test, but since you now know the anatomy, you will press on the tendon. And different from a flexed to an extend position, it will give us the answer of how severe the pain is or how long you've been in this pain. So again, if you can find identical pain on the tendon, that's another reason for you having this diagnosis. Another common reason is not to have any pain when resting. So if you don't have any pain during rest, that's also a common reason for tendinopathy. If you have pain during rest, it might be something else. It could be the quadriceps tendon that has a small tear in it, but it can still be the tendon that's the issue. But then again, if it's on the tendon, that's what we need to know. And if it's not on the tendon, then it's something else. But if it's on the tendon, we know exactly how to fix it, and you'll get soon well after following this program. Continue. This is just showing what we're going to work with, and again, showing that knowledge about the diagnosis and pain actually help you rehab quicker and more efficient from not knowing anything about your knee or anatomy or how the tendon works. So in the first period, we're going to take the load down as we talk with less frequency, less intensity, and less volume. We will still add load, but in a matter of way where your tendon is happy and not screaming. Then we're going to focus on strength of the quadriceps tendon, or sorry, muscles, and load with isometrics, just focusing on the tendon. Later on, we're going to be more sport specific, so adding into jumping and squatting. And if there's any mobility issues, we will find that out in the testing phase. And that's something you have to focus more on, not everyone. But if that's a problem for you, you have to focus on that. Also, we're going to do a lot of filming. So everything from squatting to jumping. If that is a technical issue for you, you have something to work or to make it easier for your tendon for my guidelines. Okay, so when you're training, I want you to ask yourself 3 questions because you're doing this by yourself. And one question is my pain tolerable during exercise? 3 to 4 out of a 10 is what it should be. So if it feels more painful than a 3 to 4 out of a 10, then you should take the load down or change the exercise. Again, a 3 to 4 is individual, but this is your way of understanding, no, this is too much or this is too little load for me. The second question is my pain better, worse, or same after exercise? So, again, if it's worse the day after, you've done too much. If you're putting on more load or progression your exercise from last week, then it's too much. This again is individual and is now you to back off to see that probably this was too much, or you can see on other factors like sleep, nutrition, and stuff are you taking your recovery as you should? The last question you should ask yourself: is my pain worse or the same the day after? And again, if it's the same the day after, good. If it's worse the day after, you've done too much. So then you should lower down the load either on sets, reps, or the progression. Finishing off my last guideline: everyone is different and has unique circumstances. And these are why these are my guidelines, but it's you who should follow it. So you don't, or you're able to scale or regress or progress as you need. Because someone has been had pain for a longer time and probably doesn't have to do all the exercises, and other people has been dealing with this pain for over a year, and that's why probably you should go a bit slower if you're still in pain when progressing the exercises. And of course, other factors in life will affect your recovery. With this said, I wish you the best of luck. I hope I made it crystal clear for you, but I would love your feedback. So let me know regarding the tests, these or this lecture or the program. What do you think? I'm now so deep invested in you and this program that I would love all the feedback, so I can help you regain your strength and get back to your normal training again. Wish you the best of luck and smash it.